Fast boat wave slamming causes traumatic brain injury and major injuries among speedboat operators worldwide. Hi, I'm Anthony Smith, a retired special warfare boat operator. I'm here to talk about fast boats, wave slamming, and the many injuries they cause, including traumatic brain injury and long term orthopedic injuries. Fast boats cause long term injuries. The world uses fast boats for leisure 365 days a year. In leisure boating, drinking alcohol, driving fast, colliding with waves, and colliding with other boats is a serious problem that shows thousands of injuries and fatalities every year, according to U.S. Coast Guard stats. Fast boats become dangerous and cause many injuries, as this research will show. However, civilians use leisure boats at fast speeds in calm to moderate waters. Military maritime special operators drive fast boats in really bad seas under extremely violent conditions. Although military maritime special operators are in extremely good physical shape, the toll of wave slamming over the long term causes eventual full body injuries that affect the brain and the musculoskeletal system, causing extremely dire medical injuries as a long term effect, uh, especially traumatic brain injury from millions of subconcussive impacts. This is the topic of discussion, so let's get with it. U.S. Navy Special Warfare Boat Operators, or Special Warfare Combat Crewmen, operate a variety of specialized watercraft at high rates of speed, up to 50 knots, which is give or take 65 miles an hour. Some motor HSB boats went as fast as 80 miles per hour and cause wave slamming subconcussive impacts at 1 second intervals plus or minus 3,600 impacts in an hour that generate G forces ranging from 2 to 60 Gs, with other data suggesting peaks at 102 Gs. Special boat operators experience millions of wave slamming impacts throughout their careers. Repetitive wave slamming or high G force impacts cause acceleration and deceleration subconcussive injury to the brain known as MTBI or mild traumatic brain injury, whiplash associated disorder or WADS, and musculoskeletal disorders MSDs, leading to chronic pain, disorder, chronic spinal compression, end plate fractures, vertebrae fractures, and bulging discs, which can lead to autonomic dysfunction. Long term effects of millions of subconcussive impacts also lead to neurocognitive disorders such as dementia, Alzheimer's, and eventual encephalopathy. Chronic spinal fractures, compression, and end plate fractures lead to cumulative trauma and autonomic dysfunction called dysautonomia. Furthermore, repetitive wave slamming TBI causes pituitary gland dysfunction, hypopituitarism. Over time, SB operators develop a constellation of debilitating long-term injuries and illnesses associated with TBI, WADs, SSDs, and MSDs. The long-term effects of chronic injury among high-speed boat operators in naval special warfare and their community-wide exposure to millions of head and spine impacts are within the latest diagnosis framework known as operator syndrome. Operator syndrome is authored by Christopher Free, PhD. Most NATO nations have maritime special boat operators and security forces. The U.S. has Coast Guard, fast boat operators, maritime security forces, and LCAC fast boat operators, to name a few. Worldwide, there are leisure fast boat operators, all subjected to high G force impact, wave slamming, and injury. The problem is that fast boat wave slamming, experienced at repetitive levels, causes long term injury and illnesses that are not limited to special warfare boat operators, but are consistent across all fast boat operators worldwide. And as a note, fast boats are planning boats that skim across the water, uniquely different from displacement ships. So that's something that everybody needs to understand in terms of fast boats versus ships. Skimming across the water at high speeds results in wave slamming, exposing operators to violent shock and vibration, similar to impacts experienced in motor vehicle accidents, which lead to musculoskeletal and subconcussive injuries. Therefore, this presentation will review literature worldwide, connect the dots, and demonstrate how a career in fast boat operations causes severe and life-changing injuries. Several literatures show a link between speedboat operations and chronic neurocognitive disorders, such as dementia, Alzheimer's, pain disorders, whiplash-associated disorders, and musculoskeletal disorders. This discussion retrospectively reviews much research literature that reveals boat operators worldwide suffer from the same or similar types of injuries. This research also discusses subconcussive impacts experienced during wave slamming events on fast boats and their link to traumatic brain injury and encephalopathy. A wave pounding or slamming event is when a speedboat exits the water off of a wave and impacts or re-enters the water, creating acceleration and deceleration forces on the human body. Pictures in this presentation depict NSW boats jumping out of the water, causing slamming events, also Coast Guard boats. Gowitzer in 95 defines a collision between a high-speed boat and the water as an impact or shock event. Shocks are more completely defined as individual events that disrupt the internal equilibrium of a system through a suddenly applied impulsive force. Shocks are called repeated shocks because distinguishable shocks are repeatedly encountered at sea. Gowitzer defined impacts or shocks to be 20 to 200 milliseconds in pulse width duration and at greater than 2 Gs. Some argue that shock impacts have extremely high G impacts, but short duration is less likely to cause severe injury. However, this argument is debunked when reviewing the long-term effects of injury and traumatic brain injury among retired special warfare boat operators, proving repetitive subconcussive impacts cause severe long-term injuries. I have videos on that particular topic to show that the long-term effects within the special warfare boat operator community is pretty severe. Gowitzer describes human debilitation from repeated impacts or shocks as the following: annoyance, fatigue, sleepiness, discomfort, anxiety, nausea, loss of visual acuity and hand and eye coordination, abdominal pain or discomfort, testicular pain, headaches, other head symptoms, chest pain, back pain, sprains, torn ligaments, broken ankles and legs, damaged vertebrae, and damage to internal organs, which also include the brain. That list is a pretty long list, but it's pretty consistent with what we see among special warfare boat operators in the retired community. Every SWCC can anecdotally attest to having experienced most of these symptoms more than once during their service, and as they age, develop a constellation of constant long-term morbidities. Chronic musculoskeletal pain. Ullman conducted a literature review in 2024 that covered the period of 1980 to 2022 to determine workplace-related injuries and chronic musculoskeletal pain among high-speed boat operators. Of the results, 163 search results. Out of that, 5 were chosen, 2 prospective, longitudinal, and 3 cross-sectional cohort studies were included in the systematic review. A total of 804 cases with 3,312 injuries sustained during 3,467 person years on board high-speed boats were included in the synthesis of the results. The pooled incident rate was 1 per person year. The most common injuries were related to the lower back, which was 26%, followed by the neck, 16%, and the head, 12%. The pooled prevalence of chronic pain was 74%, and 6% of the cohort consumed pain meds. Fast boats and cognitive dysfunction. The Alawas and Garmet in 2020 concluded through a 2-year research project that high-speed boat operators suffer daily occurrences of tiredness, concentration difficulties, decision-making complications, and memory recall issues, indicating significant performance degradation due to vibration exposure from high-speed boat operations. These are the same symptoms that we saw in the SWCC survey. Fast boats and musculoskeletal disorders. Zig and others back in 2013 determined that high-speed boat operator or operations cause mental disorders and musculoskeletal disorders that significantly degrade the quality of life among speedboat operators. It is also noted that mental health and musculoskeletal disorders, or MSDs, continue to degenerate with age. Zig also concluded that MSDs are the second largest occupational health issue in the world, according to the World Health Organization, and MSDs are defined as injuries to the muscle, nerves, tendons, ligaments, joints, cartilage, and spinal disc. Fast boats cause a 100% injury rate among special warfare boat operators. 100% of injury rate among SWCC, looking back at Whalen 2002 and Ensign in 2000. Whalen in 2002 authored a thesis at MIT studying optimal dead rise hulls to mitigate shock on boats, such as a purpose-built Mark V special operations craft. According to Whalen, high-speed planning boats cause acute and chronic injury to SWCC and SEAL personnel who operate on NSW boats. Whalen discusses the gradual increase of NSW boat-related injuries in the early 1990s, prompting the Naval Health Research Center to conduct surveys on special boat units personnel back in 1998 and 99. The survey conducted by Ensign in 2000 had 154 participants from SBU 12, 20, and 22. Participants in the study had a mean of age of 32, a mean height of 70 inches, average 187 pounds with a BMI of 26.4, and mean in years in the Navy of 12, and the mean years at SBU at 4.7. The study showed that 64.9% of the SBU operators reported an injury related to fast boat operations. The study also concluded that all SWCCs have a 100% injury rate by their 10th year in SWCC fast boat service. In the SWCC, fast boats wave slamming creates a severe mechanical shock environment. An MIT study in 2001 concluded anecdotal evidence backed up with injury compilation reports, craft motion studies, and injury prediction models clearly show a connection between service aboard high-speed boats and an increased rate of acute and chronic injury. The mechanical shock environment seen on these boats during typical operations can range from mild to extremely severe, depending on sea state and other factors. Current specifies current trends of almost 100% injury to SWCC operators as their time in SWCC increases, and the data indicates a relationship between mechanical shock exposure and injury occurrence. Through theoretical predictions and empirical measurements, Kearns also established that severe mechanical shock environments exist on NSW boats when operated at high speeds. Millions of sub-concussive impacts. U.S. Navy SWCC operators endure several million sub-concussive impacts in their careers. Here's how we get there. In anonymous communications with personnel at Special Warfare Group 4 and some former SWCC ops chiefs, it has been calculated and determined that the average SWCC spends just over 3,000 hours on boats in a traditional deployment cycle. In a recent online survey, 300 SWCCs averaged 5 deployments in their careers. The average boat time for SWCC operators is about 15,000 hours. Gowitz Survey 95 his study showed impacts occurring at 1 second intervals. 1 second intervals can equal 60 impacts in a minute, plus or minus 3,600 in an hour. This is similar to shaken baby syndrome for adults when this repetitive subconcussive impact continues over several years and thousands of hours. 15,000 hours times 36 equals 54 million. Obviously, that number of wave slamming impacts is very large. Although we cannot ascertain how many subconcussive impacts we each endured, we know the number is very large. Science tells us that CTE is associated with large numbers of repetitive head trauma. It is presumptive that most SWCs would deal with CTE on some level based on this knowledge. Roche conducted SE research that revealed 8,610 wave slamming impacts in 36 hours of underway time at 2G or greater. This is 2G and greater. 8610 divided by 36 hours is 239 per hour. 239 times 3,000 hours of deployment cycle is about 717,000 total impacts in a deployment if we just go by his study. These impacts range from 2 to 25 Gs. What is concerning is the repetitive subconcussive impacts, as this high volume is indicative of causing CT or encephalopathy. In another study, Dobbins and others back in 2008 operated boats for about 3 hours in 2 to 3 foot seas at 40 knots and measured over 1,000 hits or impacts ranging from 1.6 to 9 Gs. The impacts average about 300 per hour based on Dobbins' report. 300 impacts in an hour multiplied by the average hours per SWC operated being 15,000 hours based on the deployments on boats with total about 4.5 million potential subconcussive impacts in a career. Myers and others in 2010 completed a study with UK Royal Marines in which they experienced 1,842 impacts in a 3-hour period at 1.5 to 3 Gs. 1,842 divided by 3 equals 614 impacts per hour. 614 times 3,000 is about 1,842,000 impacts in a deployment cycle. So it's unknown how many impacts each of us endured, but we know the number is still very large. Each study in the past has slightly different numbers because of many environmental factors, but we know for sure that at high speeds the boat is slamming at 1-second intervals, which is a lot of repetitive wave slamming and brain injury. Fast boats cause whiplash injury or WODs. Human impact exposure on board high-speed boats. What is dangerous? An international multi-agency study, Ullman and Ullman, 2018. During a wave pounding event, whiplash occurs, causing the head and neck to move forward rapidly, creating a concussion mechanism. Biomechanical investigations dating back to the 20th century suggest concussion results from the cerebral hemisphere's rotational motion in the anterior and posterior plane around the fulcrum of the fixed in place upper brainstem. Roche in 1994 concluded that NSW/HSB operations are potentially harmful to boat operators, and the test showed HSBs exceeded exposure limits to whole body vibration. Roche noted that the National Aeronautical Space Administration has limits of shock exposure plus or minus 15 Gs in the vertical direction, which is also relational to the direction of impact, and personnel must be seated, belted in, and can only be exposed to one impact of that magnitude. Under routine operating conditions, NSW boat operators are exposed to hundreds of 15G and greater impacts in an hour. In fact, in the late 1990s and early 2000s, NSW had a research group attached their accelerometers to the Mark V SOCs, which then got underway and broke their instruments at a recorded 25 Gs. In a recent anonymous conversation with a Debrew SEAL, he was on their boats and broke the accelerometers in the first mile of the evolution, pegging the accelerometer at 60 Gs. The Mark V's were normally operated at 50 knots and sustained 25 G impacts on a consistent basis. Not only did Mark V's exceed ISO standards during a single short underway period, but they also caused severe long-term documented injuries to all the operators, which is now evidence and proof within this research. Stalnacki demonstrated that long-term symptoms of whiplash injury include neck pain, PTSD, depression, headache, irritability, poor memory, poor concentration, and fatigue. Kearns in 2001 established high-speed boat operations as a cause of whiplash mechanisms occurring to SWCC operators during high-speed boat operations. Thus, it can be established through Kearns' research that high-speed boat operations are a cause mechanism for MTBI and WODs during high-speed boat wave slamming events. Neck injury and vertebrae fractures. High-speed boat operators experience repetitive wave pounding at significant g-forces, which causes end-plate vertebral fractures to occur. When the boat slams, high impact forces cause trauma mainly to the neck and the lower back region. Fast boat injuries among U.S. Coast Guard personnel. Lieutenant Commander Butler of the U.S. Coast Guard wrote about whole body vibration effects on Coast Guard boat operators around the United States. His findings showed that ISO standards were exceeded on Coast Guard boats, even in calm conditions, sunny, 65-degree weather at 30 and 40 knots. Butler discussed resonance as a harmful effect on Coast Guard boats and described resonance occurring when vibration sources transmit at the same frequency as the receiver, which would be the human body. In Butler's study, boats emitted whole body frequencies at 0.5 to 40 hertz range, which also is the range most harmful to humans. Previous research efforts with Roche, Dobbins, and Galbitzer Kearns all showed NSW and other special operations boats emitting similar frequencies and causing the same types of long-term injuries. Butler describes negative health effects at 5 to 40 hertz ranges as certain functions and systems in the body can be disrupted, such as the vestibular system, which is the inner ear, speech, eyes, chest, head, tactile sense, depth perception, and musculoskeletal system. Furthermore, Butler explained that whole body vibration causes MSDs, low back pain, intervertebral disc failure, degeneration of the spine, spinal disc disease, herniated disc, local and monolumbar syndrome, sciatica, spondylosis, which is spinal arthritis, and other things. Lastly, Butler explains that whole body vibration exposure has negative psychological effects such as anxiety and sleeplessness or sleepiness, and can affect the nervous system, cardiovascular, digestive, respiratory, and reproductive systems. High-speed boat slamming causes severe injuries among SWCC operators. Ullman and others in 2022 conducted a study to determine if military high-speed boat slamming causes severe injuries and disabilities. 214 SWCC operators participated in the online survey, reporting 2,460 impact-related injuries, which indicates high injury potential caused by fast boat wave pounding. Results of the study showed that 1.1 injuries per year were reported by the participants, 5 times greater than that in the U.S. general population. 32% reported low back injuries, 21% reported neck injuries, 33% reported loss of consciousness on board the boats, and 70% reported impaired capacity to perform their job. 49% reported injuries related to lateral impacts, 18% to reported injuries from frontal impacts, 12% reported injuries from vertical impacts. Overall, mean injury rates over a 10-year period of service for SWCC operators reporting an online survey experience mean of 4 back injuries, 3 neck injuries, 2 head injuries, and 1 torso injury, 1 upper extremity, and 1 lower extremity injury. The conclusions of this study show that military high-speed boat wave slamming causes severe injuries and disabilities, as 72% of participants had applied for a VA disability, 62% had a VA rating of 50% or greater, and 11% actually had no rating at all. Injuries on board small boats. In the late 1990s, a Mark V SOC detachment was conducting training missions off San Clemente Island and at speeds of 50 knots and following seas. The lead Mark V plunged off a wave into the back of another wave at night. The impact crashed in the canopy and injured several personnel on board. The boat driver received 50 stitches in his face. The engineer's seat was broken, and had he been sitting in the seat, he probably would have been killed. I was on this. I was in this detachment, and I was out there when it happened. Repetitive subconcussive impacts on fast boats causes CTE. Recently, in 2021, a medically retired special warfare boat operator committed suicide. His name was SBCS Troy Norrell. Troy was medically retired due to TBI and PTSD issues. After his death, his brain was autopsied and the CTE was found in his brain tissue. However, further research is needed to conclude that SWCC personnel are subjected to potential CTE due to millions of subconcussive impacts. Let us pause and honor Troy for his sacrifice. Dr. Pearl and Premier in 2022 concluded that unique exposure from a SWCC career provided sufficient exposure for TBI and CTE development. This is based on the autopsy that they did on Troy's brain. I personally received a copy of the report from his family and some of the other things regarding Troy, so it's all been documented and verified. Not only did Troy commit suicide, but Jeremy Allen Grow and Travis Wagner Carter both committed suicide. Jeremy was back in 2010, and Travis was more recent in 2021. There aren't a lot of details about these guys and what they were going through at the time, but we do know that they committed suicide. High-speed boat slamming causes severe brain injuries among SWCC operators. Dean Lancaster did 7 deployments on 11-meter ribs. He has been diagnosed with dementia. And Bill Redman did 6 deployments on HSBs, 10 meters and 11 meters, and the Mark V. He has been diagnosed with dementia as well. As one can see, these boats jump out of the water at high speeds, and the landing is very violent. It can happen hundreds or thousands of times on training days, like what you see in these videos or pictures. Injury is certain. There is this is equivalent to shaken baby syndrome for adults, only millions of times. Acute and chronic injury among French maritime military forces. Herpin and others in 2020 researched musculoskeletal disease among French military high-speed boat pilots. 66% reported having experienced trauma, acute pain, sharp discomfort during nautical raids. 71% reported chronic pains associated with activity aboard high-speed craft. In comparison, only 18% claimed to ever see a doctor because doctors would likely limit their ability to operate. Members reported chronic pain in the neck, shoulders, upper back, lower back, thighs, knees, and ankles. Herpin and others concluded that repeated and prolonged navigation on fast boats is particularly traumatic. Acute and chronic injury among Swedish Coast Guard. The Alois in 2018 conducted a cross-sectional study on the Swedish Coast Guard, yielding results showing that 71% experienced low back pain, 3% mostly had some pain, 35.7% had pain to some extent, and 2% had such pain that caused them to change their work tasks completely. 38.6% experienced mental fatigue, headaches, tiredness, and memory recall, while 29.2% experienced concentration difficulties and decision-making impairments. Mental fatigue, headaches, memory, and concentration and decision-making issues are indicative of subconcussive exposure or MTBI. Speedboats present a high magnitude injury environment. Ullman in 2005 established that high-speed boats generate significant impacts when slamming against the water, causing trauma and injury to personnel on board, both acute and chronic. Ullman says no other professional environment exposes workers to vibration and impacts of the same magnitude. Ullman states that 50% of boat operators report neck, back, and leg injuries due to fast boat operations that produce wave slamming impacts up to 20 Gs. Deck slap injury on speedboats causes vertebrae fractures. Cellier and others in 2018 examined deck slap injuries in the French Riviera, studying data from St. Anna Military Hospital from 2010 to 2017. In that time frame, 26 vertebrae fractures were reported. In the results, the mechanism of injury observed was similar for every patient. Patients sitting on the front of the boat or the bow, 77% of the cases. Patients being in rigid inflatable boats, 65% of the cases. And when the sea state was calm, 62% of the cases. Patients were balanced up in the air because of a strong wave and landed in a sitting position. When the affected population was young, the mean average or age was 42, and women were the main victims, sex ratio of 0.3. The lesion topography was found near the thoracolumbar junction in each case. It was always a vertebral body compression. 23% of them suffered from neurologic complications. In the case of special warfare boat operators, some boats have seats and require sitting. Sitting during wave slamming causes deck slapping compression on the lumbar spine. SBs and other maritime soft operators, or people that operate fast boats at fast speeds in heavy seas and for longer periods of time, making them more susceptible to injury. Civilian injuries on board small boats. In August 26 of 2008, a 55-year-old female suffered a wedge fracture as a 9-meter ridge inflatable boat, Celtic Pioneer, maneuvered at speed in the Bristol Channel. The accident happened as the boat jumped a wave and the passenger was lifted and slammed back into her seat. On 6 May 2010, a male passenger on board a Delta 8.5 meter rib fractured his L1 and L3 vertebrae as a boat traveling at 30 knots on the River Thames in central London. The rib was powered by a Yanmar 300 horsepower stern drive motor capable of speeds of 30 knots. During the time of injury, the man was sitting on the front console and was occasionally bounced off the console as the boat would respond to waves. The river was relatively calm and the wave height in the river was 0.5 meters or 1.6 feet. The man was 34 years old and in good condition with no previous history of back injury. This incident shows an injury of severity happening in relatively calm conditions with occasional wave slamming capable of producing up to 10 G impacts. On 14 April 2009, the motorboat Ocean Ranger embarked on a sightseeing tour with several passengers on board. During the voyage, a large, steep-sided wave appeared. The captain steered the wave as best that he could, but the boat dipped off the backside of the wave and slammed heavily into the trough. Several passengers were injured. One suffered a shattered vertebrae, while another suffered a fractured sternum. On 7 June 2023, a passenger on a Sea Safari rigid inflatable boat suffered a spinal injury that left them paralyzed from the waist down. As the boat was increasing speed and heading out to sea, the boat encountered a wave in which it fell off the back side of the wave, slamming into the trough and dislodging the passenger, who suffered a vertebrae fracture during the event. And on August 22nd of 2020, a commercially operated rigid inflatable boat called the Sea Dog hit a sea buoy at speed, causing several casualties and one fatality of a 15-year-old girl. The boat was capable of speeds up to 38 knots and was used commercially to wave jump and maneuver for passengers. Leisure motorboat vertebrae fractures studied in the Mediterranean Sea. Recently, May and others in 2023 retrospectively reviewed the clinical, radiological, and contextual parameters of all motorboat-related spinal fracture cases during a 14-year period from 2006 to 2020 in the three French neurosurgical level 1 centers bordering the Mediterranean Sea. A total of 79 patients presented 90 fractures, with 100% being compression type A fractures. 71% of the patients said they were surprised by the event and that the water conditions were calm. Given that such injuries happen in calm conditions, it should not be surprising when maritime special boat operators become injured in violent conditions aboard special operations craft. Large slamming impacts cause injury. Samad and others report large slamming impacts, and these repetitive shocks may pose a danger to passengers' safety and health. When the impacts occur, the craft's bow will rise completely out of the water and subsequently impact downward on the next wave. According to the International Code of Safety for High-Speed Craft, 2000 HSC code, for the sake of passenger safety, vertical accelerations above 1 g at longitudinal center of gravity must be avoided. The sudden impact of slamming experienced by HSC may reach 25 Gs in vertical accelerations. This excessive impact produces vibrations which may lead to injury. The most common injuries are lower back and neck fractures. Epidemiological review of speedboat injuries in Thailand without collision. In 2018, Narote Trinarong from the Department of Orthopedic, Bangkok Hospital in Thailand published the epidemiology of the T-spine injuries associated with speedboat traveling without collision, a unique spine injury mechanism. The results published were all spinal injuries or single level injuries. The level of injury is mainly at the T area that involves 6 cases of the T11 vertebrae, 20 cases or 25% at the T12, 44 cases or 55% at the L1, and 10 cases or 12% at the L2 vertebrae, respectively. No injury of the cervicular or sacral region had been reported. A spinal cord or nerve root injury occurred in the lumbar region in 1 patient. All 80 injuries patterns are type A injury compression type, classified by AO spine T injury classification, including 32 levels or 40% of subtype A1, 18 levels or 22% of subtype A2, 8 levels of 10% of subtype A3, and 22 levels of 27% of subtype A4. Patients who sat in the front row seat were significantly at higher risk of a T-spine injury, and blah blah blah. No patient sitting at the rear was reported to have this injury. Notable to this research, it is commonly known that spinal injuries most commonly result from several high energy mechanisms, including motor vehicle accidents, falls from height, contact sporting activities, and extreme sport activities. Among these spinal injuries, the T-spine area accounted for a majority of all spinal injuries. ONR testing high-speed planning hulls, 28 May 2015, by Catherine Crawford, Office of Naval Research, Public Affairs. Planning hulls are like those used on a speedboat. They're designed to produce lift and allow the watercraft to glide on top of the water, skimming more quickly over its surface. At higher speeds, waves become a problem. The higher the crest of the waves, the more the boat will rise to the top of the wave and then fall down to the wave's trough with great force. This is known as a wave slam. When a hull is going at speed and it hits a wave, it's like hitting a wall. It's a violent collision, and the forces are very large, said Dr. Brizzolara, a program officer in ONR's Sea Warfare and Weapons Department. This causes injuries to sailors, commonly back and leg injuries, and also can degrade the structure of the vessel. In conclusion, over 2 decades of research show acute and chronic injuries are related to fast boat wave slamming worldwide. Retired and former SWCS experience long-term chronic issues, including the following: anxiety, depression, PTSD, TBI, insomnia, sleep apnea, chronic pain, spinal degeneration, orthopedic injuries, anger, irritation, low testosterone, and other hormonal issues, endocrine dysfunction, orthopedic injuries, degenerative joint disease, migraines, headaches, ED, high blood pressure, high cholesterol, and many other things. Other SWCS now suffer from neurocognitive issues and disorders such as seizures, tremors, dementia, Alzheimer's, Parkinson's, and presumptive CTE. To date, we can account for several suicides due to TBI-related issues. Many other fast boat operators worldwide suffer chronic injuries due to fast boat operations. Although the main focus of this research is special warfare boat operator injuries and TBI, all fast boat operators face the same issues.